What's going on, guys? This is Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about hip abduction and strengthening the glute medius muscle and the glute minimus muscle, which is in the side of the butt. Super important muscle. It's one that's, I think, is one of the most important muscles to train, and nobody's really training it, or if they are, they're not training it enough or the right way. And I also see this this is one of the ones I see on social media all the time, and people are butchering it. So what we want to do is isolate that glute muscle, okay? So this is a super muscle. Also, my runners. This muscle, super important when you're landing on one leg. And if you're a runner and you like to run long distance, you're landing on one leg a lot, aren't you? Like every other freaking second. So we need to fire this muscle the right way so that it can support your pelvis, okay? So real quick, without me standing and getting out of the shot, when I'm on one leg or one knee, this muscle is in charge of keeping my pelvis neutral. So if this muscle gets weak, I start to dip. Let me show you standing. So if this muscle is weak, I start to dip down and I get lazy, and then that puts more stress on my joint and other knee joints and other things. So if every time I land, I let this collapse happen, I'm exaggerating, over time we're going to get bursitis of the hips, we're going to get some runner's knee, we're going to get all those kind of typical tendonitis type issues. We need this to be really tall, be able to stand for a long time on this and kind of keep that pelvis neutral. And this exercise is the way to start building that, okay? So we're gonna get flat. Don't be up here, guys. Get flat, get relaxed, put a pillow if your neck's uncomfortable, put your arm there, whatever's comfortable. All right, keys to this exercise. So I'm going to want to roll my hips forward, okay? What I see a lot of people doing is they stay back here, they start raising their leg up, and then they're drifting further and further back as they're getting, I'm exaggerating again, they're drifting further and further back as they're getting fatigued, and now it's a whole other exercise, okay? So on our side, and what I tell people, I want you to be quarter turn towards your belly. So you're almost on your left chest here and a little bit on your abdominal muscle. Not fully there, just quarter turn. What I want to do is kind of put some pressure into my pelvis. The other thing I see people doing is when they come up, they start to move their pelvis in and out, okay? Now I'm using muscles up here. I'm using other muscles that I'm not isolating this anymore. I want to be able to isolate it and separate it from my lumbar spine. So I'm pushing this down. I'm kind of holding it in place, so to speak. And then I'm doing that quarter turn. I'm elongating my foot away from me. I'm trying to slide against the wall that's over there, okay? So I don't want to be bunched up. I'm elongating, and then I'm going up, okay? Now, it doesn't have to be crazy high. I don't want to get so high where I start to lose this. It's just a little. You can hold for a second, and you want to isolate that glute muscle right there. Good. Progress that. Guys, I want you to be able to do at least 15 reps of that without fatiguing, but really like 25, 30. If you're an athlete, you should be able to do 50 of that, no problem. And if you can't do that, again, we can't progress to those higher level stuff without risking injury if we can't do these foundational movement patterns. So my hip patients, my knee patients, my low back patients, this is training 101. My athletes, try this out. If you can't perfect it, work on it, and then progress to some higher level glute strengthening, standing up and in the squat rack and all that kind of stuff, all right? Until next time, I'll see you guys. Dr. Greg with Movement Driven Performance Physiotherapy. Have a good one.